All right, so as we told you at the start of the show, October 1, today is the start of Breast Cancer Awareness Month, and the Jamaica Cancer Society is raising public awareness about this disease and the importance of early detection and screening. Unfortunately, I've had a couple of members of my family who have actually lost their breasts because of breast cancer. But join us are Dr. Hugh Roberts, Consultant General Surgeon at KPH and Associate Lecturer at UWI-Mona, along with Julian Brown, who is Public Relations and Fundraising Officer at Jamaica Cancer Society. Julian on the phone and Dr. Roberts on Zoom with us. Good morning to you both. Welcome to Smile Jamaica.
Hi, morning, everyone. How are you guys doing?
Dr. Roberts, let me just get something out of the way. A male can get breast cancer, right?
Yeah, I mean, males can get breast cancer, but it's extremely rare.
Yeah.
In my career, I've probably done over 500 females, and I probably speak for most others, all done a lot of breast cancer in females, and I've probably only seen about 3 or 4 males my entire career of breast cancer.
Okay,
So
forgive.
but when it, unfortunately, men usually get it at an advanced stage.
Okay.
And it,
And forgive my ignorance, but does it present the same way as if a woman would have it? You feel a lump and stuff like that? Is that what happens?
remember, the man is a lot less. It's just a little bit of fat and the underlying. So we don't know if it's genetics as well as the anatomy of the breast being a lot less thick as compared to the woman, because as you remember, female's breast, depending on their size, it's always going to be pendulous. And then the female breast has also the glandular and lobular elements, which is where the breast cancer originates. The glandular and the lobular elements is what's responsible for the production of milk.
Okay.
And that's where when we're talking about breast cancer, that's where we're already talking about the cancer originates from.
Okay. Before Ms. Brown tells us what the Cancer Society has in store for us this month, talk me through it. As I said, early detection. So what do you do? What do you do? Talk me through this.
Yes, we're having this conversation with you guys at the Cancer Society to promote screening for breast cancer. And that's basically where you try to pick up the disease either before it becomes cancerous, or you want to pick up the disease at an early stage. For breast cancer, what you're trying to do is pick it up at an early stage, which means you want to pick it up when the tumor cells are smaller, where it's more so just confined to the breast, so that when you implement treatment, the person has a better outcome for survival. A perfect example of where screening works, because I mean, obviously it works for breast cancer, but a perfect example where screening works is cervical cancer. You know, I'm not trying to take over the gynecologist, and this is October, which is breast, but I'm just giving you an example. So cervical cancer used to be number one cancer amongst women, but since the advent of the pap smear, one, and since you found out exactly how cervical cancer is formed in terms of HPV and there's a vaccine, you realize that there's a significant reduction in cervical cancer. Unfortunately, breast cancer is different. You can't really find a precursor lesion. All you can do is just pick it up at the earliest stage.
Yeah.
And that leads to the issue that you're probably going to ask me, which has to do with the fact of how do our women tend to present compared to other countries.
Right.
And our women tend to present at a more advanced stage. So either late stage 2, stage 3, which is usually when the tumor is significantly large or there's inflammatory breast cancer and it's spread to the armpit. Or unfortunately, sometimes they present with stage 4, which means the tumor is spread to the vital organs. And when you compare our figures with North America and Europe and other first world countries, you usually find we have about 3 times the number of women who present in terms of percentage compared to those countries at advanced stage. So one of the things with screening, we want to actually reduce the number of advanced cancers and try to get earlier cancers so that people will have a better outcome. And that's where the Cancer Society comes into play.
Yeah. Dr. Roberts, a picture came up when you saw like someone holding the breast, and I know you feel for the lump and stuff, and when you find the lump, you're supposed to get it tested. Can you have breast cancer without that lump anywhere?
Yeah, so breast cancer usually presents as a painless lump. That being said, I want women to realize that 7 to 8 times out of 10, when you do present with a lump to the doctor, whether it's a GP, your gynecologist, or you even refer to a surgeon, majority of those lumps are going to be non-cancerous, but it usually presents as a painless lump. Another myth is that people think that when it's painful, that's breast cancer. breast cancer can present as a painful lump, but that's usually when it's at an advanced stage, so that's rare. You also saw the images there. Those were mammography. Those were images from mammography. And if you don't have a lump, that's the advantage of the mammogram because the mammogram is able to detect those lesions that are very small, that are not able to be felt by the doctor or the nurse who's trained at examining the breast. And that's where the whole screening comes into play. So what happens is the lump starts as microscopic cells and then they continue to grow larger and larger and larger. And when they become a certain size, which is variable depending on the location of the lump, meaning how deep it is in a woman's breast, as well as how big a woman's breast is. But I say usually the lump has to become at least, I would say, 1 centimeter to be easily felt by a clinician.
Okay. Okay.
Well, yeah, so if we pick it up with a mammogram at an earlier stage, that's even better outcome for the patient.
All right. Ms. Brown, morning again. What have you guys got planned for this month? Ms. Brown, can you hear me? Oh, I seem to have lost Ms. Brown. How prevalent is it in Jamaica, Dr. Roberts?
We have variable statistics. It's somewhere between 8 and 14%. There's some studies that say around 12% risk, woman's lifetime risk of developing breast cancer, which is a little bit above what you see all over the world. But breast cancer is something that affects all populations, whether you're black, you're white, you're rich, you're poor, you're Jew, you're Chinese, whatever.
Right.
The sad thing is that a lot of times we do get statistics from North America and Europe, and you can clearly understand that there is an ethnic portion that has a effect on breast cancer. Their populations are different to ours. We do have local statistics and statistics out of the Caribbean. And unfortunately, as I mentioned, one of the things about our cancer being at a more advanced stage on presentation, unfortunately, also what also happens in our population is that compared to a lot of these countries, usually find that we get earlier onset breast cancer. So it means it also happens at a younger age.
Yeah.
You see some countries in North America in Europe start telling you that they should start screening at 50. We can't start screening at 50 because about 33 to 35% of our women actually get breast cancer under the age of 50.
Yeah, okay. Ms. Brown is back with us, I think. Can you hear me, Ms. Brown? All right, so we're still having problems. Dr. Roberts, it's not a death sentence. My mom lived for 21 years after she took her breast off. But what about the recurrence of cancer? If you do have breast cancer, it's treated, maybe you're cancer-free. What about it coming back?
So I know you experienced, and you probably experienced firsthand because you had family members with breast cancer. So I'm not the only person as a surgeon, as you know, that's involved in the treatment of breast cancer. It's a multimodal approach. So there are other specialists in medicine that also have a vital role in the management of breast cancer, such as the hematologists who are responsible for giving chemotherapy and the radiotherapists who may also give radiotherapy. Obviously, the recurrence rate is also determined on how advanced you present, what stage it is. So the higher the stage, and we usually start from stage 1, which is early stage. Stage 2 is also early stage. When you get into stage 3, that's advanced stage, and the recurrence rate increases as you go further up. There are some other things that are more medical that affect stage, but the more important that I want to get out to people there, as you rightfully said, it's not a death sentence. The majority of women who do have breast cancer will survive and they will do very well. And even if you do have a recurrence, that recurrence can be treated. The important thing is that one is to get treatment. And before you even get treatment, even if you're asymptomatic, when you reach a certain age, I would say around 40 or 45, you should definitely start consulting with your GP, your gynecologist, or even your surgeon in terms of just doing routine screening. Once you do get treatment, it is not only a physical problem, but it also undergoes mental stress with you and your family, and that's understandable. But I think all of those persons will be along the way to help you. And as I said, the majority of people do survive. And then the important thing is also to understand the follow-up with patients so that you can look for that recurrence.
Yeah. Final question, Doc. The recurrence would be breast cancer again or cancer in...
So one of the risks for breast cancer is actually having cancer in the other breast. So if you had cancer in your left breast and that's been treated, yes, you can get local recurrence in that left breast. But one of the things is that you can also get another cancer now developing in the right breast as well. So that's something that, because I think some of the myths people feel is once you get cancer once, you're good for the rest of your life. Unfortunately, with breast cancer, one of the risks is that you can get recurrence in the same site and you can get recurrence in the other breasts. As I said, the recurrence is mainly due to the stage, but recurrence is also due to the different treatment modalities that you get. So every time if you do have breast cancer, you would have an individualized approach with your doctors. That's your surgeon, your hemoncologist. Everybody will be having discussions with you, taking into consideration what your recurrence rate would be, and that would determine how they would treat you and how they would follow you up.
Thank you so much for speaking with us this morning, sir. Unfortunately, we never had an opportunity to hear from the folks from the Cancer Society, but please stay safe, sir, and I thank you for what you are doing for us.
Thanks for allowing me to laugh watching you try to do the Ravers Clavers dance.
And I'm sure you learned a couple of moves, didn't you, sir? Just say yes.
I just say yes to make you feel happy.
Stay safe, sir. Thanks a lot for speaking with us this morning. Dr. Hugh Roberts, Consultant General Surgeon at KPH and Associate Lecturer at UWI. Unfortunately, Ms. Julianne Brown, the Public Relations and Fundraising Officer at Jamaica Cancer Society, we had some issues there. But I suspect if you want to know what the Cancer Society is up to, and I'm sure they have a website, or you could give them a call and find out. Hugely important month. And as I said, unfortunately for me, a couple of members of my family had breast cancer. But as I said, my mom lost her breast in 1987, and she lived until 2008. So it's not a death sentence. So check yourself, as they say, and don't be scared to go. It's better to know than to not know what's going on. All right?